So the topic is interstitial lung disease. So what is interstitial lung disease? It's a problem in the interstitial space. So what is the problem? There is some remodeling of interstitium of lung. So that is the problem. And what is this remodeling? What is happening? The main pathology is fibrosis. The main pathology is fibrosis, and you know that fibrosis can cause by TGF beta or can be due to PDGF, platelet derived growth factor, like this. Now interstitial lung disease can be of two types, like unknown and known. Known is not our concern. We are only concerned about the unknown etiology interstitial lung disease. Among unknown causes, but first I want to tell the unknown cause ILD is also known as idiopathic interstitial pneumonia. So idiopathic interstitial pneumonia is the other name of the unknown cause ILD. Now the first type is known as usual interstitial pneumonia. Usual interstitial pneumonia is the first type, otherwise known as idiopathic pulmonary fibrosis. So usual interstitial pneumonia, otherwise known as idiopathic pulmonary fibrosis, it is the most common type of unknown causes ILD. It is the diagnosis of exclusion. Yes, you can get some features like honeycombing pattern, like reticular opacities, like that, like traction bronchiectasis, but still it is the diagnosis of exclusion, as it is the most common type. So you have to rule out others before telling that it's an usual interstitial pneumonia or idiopathic pulmonary fibrosis. The next type is NSIP or non-specific interstitial pneumonia. It's very important because it is associated with systemic sclerosis. So you will give a history of systemic sclerosis patient and you will ask that what is the ILD present in this patient. Answer will be NSIP. Third, a rare variety, but it's very dangerous, very fulminant. It's known as acute interstitial pneumonia, otherwise known as Hamann-Rich syndrome. So Hamann-Rich syndrome or acute interstitial pneumonia, rare, fulminant, dangerous, diffuse alveolar damage is happened there. So that is the point. Then there is someone known as desquamative interstitial pneumonia, someone like the respiratory bronchiolitis associated interstitial lung disease, lymphocytic interstitial pneumonia, like this. But this UIP, NSIP, AIP, these three are mainly important thing. Now HRCT, we have to diagnose interstitial lung disease by HRCT. All know that. Now what are the features of ILD? You will get cough, but the important thing, this cough will be dry cough or non-productive cough. Next, there will be breathlessness, and third, the most important point, you will get fine inspiratory crackles. So every word is important. It is fine, it is inspiratory. So fine inspiratory crackle, otherwise known as Velcro crackle. So that's not coarse, not expiratory, it's fine inspiratory. That's it. Now come to the UIP. I already told that it's the most common usual interstitial pneumonia. It's done by HRCT. It's the diagnosis of exclusion. But I already told you, you will get honeycomb pattern or like traction bronchiectasis, like that, and you will get a reticular opacity like that, but that's not important. It's diagnosis of exclusion. That's it. NSIP, I already told you, NSIP is associated with systemic sclerosis. Here you will get homogeneous interstitial involvement. Homogeneous involvement of interstitium. The treatment is by azathioprine, cyclophosphamide and steroid. So important point is steroid is used in case of NSIP. AIP, acute interstitial pneumonia, otherwise known as Hamann-Rich syndrome. It's a dangerous fulminant, sometimes preceded by a viral URTI or upper respiratory infection. Here you will get diffuse alveolar damage and like that. So that's it. Now smoking is associated with some of the ILD, like desquamative interstitial pneumonia, respiratory bronchiolitis associated ILD, and Langerhans histiocytosis. So they are the things which are associated with smoking. One type of ILD known as pulmonary lymphangiomatosis. Pulmonary lymphangiomyomatosis. Important point, it is seen in young female. So obviously you can now know it is not associated with smoking. So you will be asked which of the following ILD is not associated with smoking. Answer will be pulmonary lymphangiomyomatosis. It is associated with tuberous sclerosis. It's a very important thing. So pulmonary lymphangiomyomatosis, it is associated with tuberous sclerosis but not with smoking. ILD is a restrictive lung disease. You will see the video, the previous video, it's a restrictive lung disease. But in this pulmonary lymphangiomyomatosis, you will get obstructive and restrictive pattern both. You will also see some pneumothorax, can see pneumothorax or chylous effusion. So that type of thing you can see in this pulmonary lymphangiomyomatosis. Now one thing known as pulmonary alveolar proteinosis, you all know that this is a thing known as pulmonary alveolar proteinosis. Why this is happening? Because of impaired surfactant clearance. So surfactant clearance is not good. That's why this disease happened. Pulmonary alveolar proteinosis, and you will get a gelatinous, crunchy and pus positive sputum. That is important point. Now it can be congenital, but that's not important. It can be congenital like the SPP gene, SP surfactant protein B gene mutation. For this can happen congenitally, but the most common is acquired type. Because acquired, it's an autoimmune disorder and it is due to antibody against this GM, granulocyte macrophage CSF, colony stimulating factor. This antibody is forming against them, and obviously there will be defective macrophage and there will be a impaired surfactant clearance, leads to acquired cause of pulmonary alveolar proteinosis, and it is the most common type. HRCT will get crazy pavement pattern, but you all know it's not a specific crazy pavement pattern seen in other condition like silicosis. Pneumoconiosis, I have nothing to tell. You all know bagasosis, asbestosis you know, silicosis you know, bagasosis is by sugarcane dust, bicinosis by cotton, farmer lung by actinomyces, thermophilic actinomyces, you all know that. TB is related with silicosis, that I want to tell, and silicosis you also get the crazy pavement pattern. I already told you that. Now Kaplan syndrome is actually rheumatoid arthritis plus pneumoconiosis. This is known as Kaplan syndrome. Rheumatoid arthritis with pneumoconiosis, it is known as Kaplan syndrome. First we actually told that rheumatoid arthritis along with anthracosis, it is Kaplan. Nowadays it is told that rheumatoid arthritis with silicosis Kaplan syndrome, but we more very broader term we will say that rheumatoid arthritis with pneumoconiosis is known as Kaplan syndrome. So that's all about interstitial lung disease.